My name is Brian Hudson, and this is my story. I'm a Lean Six Sigma coordinator for Franciscan St. Elizabeth Health. Lean Six Sigma constitutes work in looking to improve processes in a variety of departments. Back in 2007, I was approached to use the Lean Six Sigma improvement methodology on what they call the door-to-balloon process. The door-to-balloon interval that we measure is from the door time of the patient arriving at the hospital through to the balloon, or where the angioplasty procedure happens in the cath lab. The national initiative was to try and get that time to 90 minutes, and we found when we collected the data that we were at 114 minutes. As we started working on that, we saw a pretty consistent improvement in those times, and it was about a year later we saw that we were regularly meeting the 90-minute goal. I'd been working on the door-to-balloon initiative for the hospital for about a year when in March of 2009 I started having some chest pain one morning. It was early in the morning and I was out exercising in front of my house. I was talking to my wife that morning and she asked me how I was feeling, what were my symptoms and what was going on, and I told her I was having trouble breathing and couldn't catch my breath. And she said, well, given the work that you've done with the hospital people on your team, what would those folks have you do? And I said, without hesitation, they would have me checked out. I knew based on the work that I'd had with the door-to-balloon team that when I came in and said chest pain at the triage desk, that things were going to happen quickly.
The emergency room doctor came up and grabbed me and said, he's having a heart attack and I need to call your family to come and sit with you.
Got my basic information, got me back to a room where a number of staff members diverged on me, putting the stickers on me to get the EKG, giving me some medication.
I noticed that when we were in the emergency department and stuff, Brian was watching the clock the whole time, and he had a mental checklist. I could tell that he was checking these things off. This is exactly what time it should be happening. This is exactly, what should be going on.
My diagnosis was that I had 100% blockage of the right coronary artery. So what they did was they went in with a balloon and they go into the area, affected artery, and they blow up that balloon. It's very small. They blow up that area and push the plaque back out of the way. Then they come back and they put what's called a stent in there, basically like a metal mesh that goes into the area, and they use the balloon to open that up. And when they do that, then that mesh holds that area open so that blood flow can continue or resume in that area of the heart. After the procedure in the cath lab, I was there and everything had happened. It all seemed to happen so quickly. Still, I just could not get my head around that this had just happened to me, that I had had a heart attack. It was just not possible. I did not have the classic risk factors that a lot of people have when they have a heart attack. And shortly after my stay in the hospital, I started cardiac rehab. I was really amazed that I was very wiped out after the heart attack. It took probably 6 months really for me to feel much better, but through working with the cardiac rehab staff, it really helped me build my confidence. It had helped me to lose some weight and helped me really feel better about myself and get me started off and going well to recovery. Since that time, I've continued to improve my health, but I've also worked to become an advocate for the American Heart Association, becoming very active in their work in the community. And really, I think that my work going forward is to try and inform people of cardiovascular disease, signs and symptoms of heart attack and stroke, and the lifestyle changes and the things that they need to be doing to take care of themselves so that they don't progress into these sorts of conditions. But what's amazing about this is that these people do this for everybody that comes to St. Elizabeth hospitals. It wasn't just for me, it's just what they do when a patient is coming in, whether it's a trauma situation, a heart attack, a stroke, whatever the case may be. They do everything that they can, use all the technology and equipment that they have available to take care of the patients that we have.